Do you know the difference between a counselor and a clinical social worker? Hey everybody, my name's Dr. Scott Giacomucci. I'm a clinical social worker and trauma therapist and educator. And in this video, I'm going to be talking about the similarities and differences between a clinical social worker and a mental health counselor. So this video will be useful if you're looking for a therapist and unsure about all the letters after people's names and which profession or professional to seek. Or if you're considering grad school and you're stuck between a master's in counseling or a master's in social work. So counselors and social workers have a lot in common. And in most states, counselors and social workers can pretty much do the same exact jobs. Many employers will hire counselors and clinical social workers for the same exact job openings. For example, an addictions counselor or a behavioral health therapist or a mental health counselor. These roles within agencies are often open for individuals who have a degree in counseling or a degree in social work. So in reality, most of the time, these professionals are doing the same jobs. However, there's a key difference between a clinical social worker and a counselor. Even though they have a lot in common, there's some significant differences. The profession of social work is much more expansive and broad than the profession of counseling. And social workers can choose to specialize in clinical social work, which is focused on working with individuals and providing psychotherapy and counseling and treating mental health issues. Or social workers in school can choose to focus on macro social work, which is focused on policy and community organizing and larger systemic issues. So usually social workers in their graduate program, their first year is a foundational year, which is the same for everybody. And it's very broad in general. And then in their second year, social workers choose where they're going to specialize. If they're going to specialize in clinical, in which case they're required to take a handful of classes that are more focused on doing psychotherapy and casework and working with individuals and families and couples. Or if they're going to specialize in macro social work, policy, and community organizing, in which case they're required to take courses related to those topics. So the profession of social work is much broader than the profession of counseling, which in some ways is a good thing and in some ways is limiting. Counseling education is much more specific to providing mental health counseling, and it doesn't focus as much on larger issues related to policy, related to systemic issues or community organizing. Nowadays, there's a bit more talk about that within counseling programs, particularly an emphasis on multicultural counseling or anti-oppressive counseling or social justice as it impacts counseling. But overall, the social work profession is going to be much more focused on social justice than the counseling profession. So much so that social justice is actually a core value of the social work profession. So the educational requirements are pretty similar for social workers and for counselors. For a full-time graduate student, a social work degree takes 2 years and 2 separate internships, each internship being an entire academic year. So 2 semesters in one internship, 2 semesters in another internship. And the first internship is 15 hours a week, 2 days. The second internship is 22 and a half hours a week or 3 days. So pretty rigorous internship requirements, whereas a graduate degree in counseling usually can also be completed in 2 years full-time, and it requires 3 semesters of internship and practicum. So social work requires 4 semesters, counseling requires 3 semesters. And in counseling, the first semester of field placement is called practicum, and it usually is about 7 or 8 hours a week or 1 day. And then that's followed up by 2 internship semesters, which are usually about 15 hours a week or 2 days a week. So this is really useful to know if you're considering pursuing a master's in either counseling or social work and you're not sure what direction to go. There's a real benefit to being able to complete 2 different internships that are a longer period of time in 2 different agencies. You get more experience in terms of internship experience in social work school. However, sometimes this is just not logistically or financially possible for students. And a counseling degree, you could do all 3 semesters in the same agency, so you might get a more in-depth internship experience because it's longer. You'll have the chance to work with clients on a longer timeline. And it just might work better for many people's schedules to not have to do 2 separate years of internship and to be able to do it all in 1 calendar year, 3 semesters back to back to back. In my experience, I've taught in both graduate counseling programs and graduate social work programs, and I've hired and trained both social workers and counselors. And in any given year in my outpatient center, I host about 4 or 5 graduate counseling students and 4 or 5 graduate social work students. And I've been doing that for a couple of years now, so I've really got to see the differences overall between counseling students and social work students, between counselors and social workers. One of the things that I've noticed is that in general, the social workers I work with tend to be more connected to larger social justice issues, to community needs, and to systemic problems, and better able to kind of bridge the gap between what an individual is experiencing and what's going on in the world and in society. However, I found that counselors and counseling students tend to get much more specific training and education on really foundational aspects of counseling, like suicide assessment or specific counseling skills and interventions, that their entire program is focused on counseling. And so because of that, they're spending more time specifically looking at counseling skills and competencies. So I pretty consistently find that the counseling students that I supervise are more prepared to be counselors than the social work students, and are better equipped at assessing, treating, and providing counseling. At the same time, I also have to say that as a clinical social worker, I do have a bit of a bias towards clinical social work, and many of the best psychotherapists that I know are clinical social workers. So while the schooling and the philosophy of the field is a bit different between counseling and social work, when somebody finishes their program, the postgraduate training that they might choose to pursue could be the same. And so the further somebody is away from their graduate degree, the more likely it is that they're going to overlap with social work or counseling, and the less likely their degree is going to have much of an influence on their work. For example, you might have someone that went and did a counseling degree and didn't learn a whole lot about social justice or social policy and systemic issues in their counseling program. But in the years after their counseling program, they did a bunch of trainings and educated themselves about those issues, and maybe they became a specialist in that area. Whereas you might experience, social worker might experience the opposite, that in their social work program, they learned a lot about social policy and systemic issues and social justice. And then in the years after their program, they focused more on psychotherapy education and specialization. And 10 years out of school, they might be a lot less focused on policy and community issues and much more focused on psychotherapy issues. So if you're looking for a therapist who's more aware of social issues, you're probably a little more likely to find what you're looking for in a clinical social worker, in somebody who holds an LCSW license or an MSW degree. However, If you're looking for a therapist that's received more thorough training specific to counseling, then you probably want to look for a counselor. And so somebody who has the credentials LPC, or sometimes it's LMHC, licensed mental health counselor, or LPC is licensed professional counselor, or they might have an MA and Masters of Arts in Counseling, or an MS, a Masters of Science in Counseling, after their name. So, in conclusion, there's a lot in common between social workers and counselors, and most insurance companies are going to reimburse an LCSW and an LPC the same rate. LPCs and LCSWs are often doing the same exact jobs, have very similar skills and competencies, and can receive the same postgraduate training. However, there's some fundamental difference in their philosophy of their field, and at the same time, a ton of overlap in the philosophy of their fields. They probably have a lot more in common than they have different. So I hope this video helps you, whether you're pursuing counseling or psychotherapy and not sure where to start, or if you're somebody that's considering a degree in counseling or social work and you're not sure about the differences between becoming a counselor or becoming a social worker. If you're interested in learning more about the mental health field or about trauma therapy, I'd encourage you to subscribe to our channel and check out some of the other videos that we've posted.